Hi, I'm Francisco Garcini, and I'm board certified in obstetrics and gynecology. I specialize in minimally invasive gynecology, including laparoscopic and robotic surgery. I'm in practice in New Lenox, Illinois, a suburb of Chicago. What is a uterine ablation, and why would I have a uterine ablation? A uterine ablation is a minimally invasive procedure that is used to treat irregular, excessive uterine bleeding. The procedure involves a treatment of endometrium, or the inside lining of the uterine cavity, with the purpose of destroying or disabling that lining, thus preventing it from regenerating and shedding every month. This procedure is designed to be a hysterectomy sparing procedure for women with excessive bleeding. There are multiple techniques to destroy the endometrium, and each individual physician may have a preference as to what technique to use. However, regardless of what technique is used, the uterine cavity is always accessed through normal orifices. The physician will introduce the device of choice through the vagina and the endocervical canal and promptly remove it after completion of the procedure. No organs are removed, and there is no effect on ovarian function. Will I be admitted to a hospital for my ablation? How long is recovery? And can I go back to work tomorrow? A uterine ablation is generally performed in the physician's office or as an outpatient procedure in the hospital. The procedure is quick. It usually requires only minimal sedation and/or pain medication, and no incisions are required. The recovery process is quick with minimal post-procedure pain, and most women are back to their normal activities the following day. How do I know whether to have an ablation or some other treatment for heavy bleeding? An ablation addresses excessive or irregular uterine bleeding. Therefore, it is ideal for women who have irregular heavy uterine bleeding. In some cases, it may relieve pain that is associated with the heavy bleeding. However, ablations generally are not effective if the cause of abnormal bleeding is due to fibroids or adenomyosis. It is important to note that uterine ablations should never be performed without appropriate evaluation of the uterine lining. This evaluation usually includes a biopsy of the uterine lining and sometimes a visual inspection of the uterine cavity to rule out the possibility of a uterine malignancy. I would still like to have children. Is ablation a good choice for me for my heavy periods? Ablations are not suitable for women who desire future fertility. By treating the lining of the uterine cavity, we are significantly impairing the ability for a woman to carry a normal pregnancy. Having said that, the procedure, however, is not designed to be, nor can it be relied on to be a contraceptive method. Therefore, additional contraceptive or sterilization methods need to be considered. What risks should I consider before I have an ablation? Risks associated with this procedure vary depending on what technique is used to perform the ablation. However, because of the minimally invasive nature of the procedure, it is considered a relatively safe procedure with minimal, if any, complications. However, any procedure has risks, and risks that need to be considered include uterine wall perforation or laceration, burns to the uterus, vagina, or bowel, and the risk of formation of blood clots in the pulmonary circulation.